Hi, welcome to the Champaign County Healthcare Consumers Healthcare Fact Chat video. My name is Claudia Lennhoff. I'm the Executive Director.
And I'm Adani Sanchez, Client Services Coordinator.
And if we look a little worse for wear, it's because we are talking today about the Senate Healthcare Showdown and the process that is going on. And I think it's important to just start by saying that it's absolute madness. What is happening in the Senate now is not business as usual.
It's not precedented. It's not normal. Yeah. Like, there isn't record of how this is normally supposed to go.
Yeah.
Like, this is just really irregular and erratic. And
really the consequences are tremendous. They're really tremendous. This has been likened to trying to assemble an airplane as it's flying. It's nuts. So we're not going to go through every detail of what's happening. We want to hit the high points and where it's going so that people understand. But this started with McCain, Senator McCain, making a dramatic return to the Senate to cast his vote on the motion to proceed. If he had not come back for that vote, or if he had voted no, we wouldn't be going through this right now. But what happened is he voted yes on the motion to proceed, and so there were only 2 no votes on that. And so then Mike Pence broke the tie, and then this process started. But then, of course, McCain gave a big speech about how the Senate should return to regular order. His big speech was sort of an argument against the vote that he just made. But his yes vote essentially helped ensure what's happening now, which is, the most chaotic, disorderly, secretive, rushed, and dangerous process that we have ever seen.
I almost hesitate to call it a process. That seems almost to give it too much order.
Yeah. And as we are recording this right now, the Senate Republicans are crafting their health care bill during lunch. So much for the most deliberative body in the U.S. government. So what we wanted to talk about is, not so much what has happened so far, but where this is going, because that is the most important thing. It's important to understand that right now they are still within their 20 hours of debate, and a couple bills have failed, one being BICRA and then the other one being the Obamacare Repeal Reconciliation Act. But now probably what you're hearing a lot about is what's being called this skinny repeal. And it sounds like it's minor.
Right.
And it's anything but. So the Votorama will be tonight, and it'll start tonight, and that's like rapid fire amendments being considered, voted on up or down. Not really any discussion about those amendments. But the amendments will be probably on the skinny repeal bill.
Which we haven't seen yet.
We haven't seen it yet. And the thing to understand is that when it's all over and done, the last amendment is the most important one. And that is the one that McConnell is expected to cast. And that is the amendment that could wipe out anything that came before it. And it could substitute the so-called skinny repeal bill as the bill that ends up being decided upon. So let's talk about the skinny repeal. The name is very misleading. It makes it sound like the consequences are relatively minor, but they're actually really far-reaching. And right now, it has 3 major components.
So it's going to repeal the individual mandate, repeal the employer mandate, and also repeals the medical device tax.
Oh, those medical device companies must have a hell of a lobby to have that.
It's only
in there.
considered skinny because it has very few sections. It doesn't have multiple long sections. It just has kind of 3 main tenets.
We want people to not be misled by the name of it. The implications would be far-reaching. And in fact, the CBO has come out and said that this bill, if it went forward as it is now, it would ravage the insurance market. And it would add, the number of uninsured would increase by 15 million, and premiums would go up by 20% right off the bat. But one of the really interesting things that we're seeing is the insurance industry coming out against this and saying that this would be devastating, and not even necessarily in 2019,
right now.
but actually right now, because they're making decisions right now about whether to enter the markets and offer their plans, and they just don't. There's so much disruption to the markets.
Repealing the individual mandate would be enacted immediately. Like, that was something that would effectively take place now, like right now. So when these health insurance companies are trying to decide about whether or not they want to be on the marketplace in 2018, if there isn't like this law to kind of help incentivize people to get on and to buy these plans,
especially healthy people,
then the insurance companies are looking at a loss, at a huge loss. If only sick people are going into the marketplaces. It already took them so long to figure out how to price these plans, who's in the market, who's in this individual market, and then this is completely upending those past years where they finally kind of figured out where these premiums need to be, what does it cost, and so this is really going to be very problematic for people who are on the individual market and for the health insurance companies who are trying to make plans for 2018.
So the other thing that the Republicans are saying about the skinny repeal is that it's really just a device, that it's a device so that they can, move the process forward, go to a conference committee with the House, and then come up with a bill. And, I think that could be disingenuous as well, but it can also be very frightening, because then we could see more provisions added to the bill, and we don't know what's in there. We do know that they very much want to cut the Medicaid funds.
Yep.
That's not in the skinny repeal now, but you can bet that if it goes to conference with the House, that we will start seeing Medicaid cuts and the changes in the financing structure getting added in there.
Senator John Cornyn has already said as much. He's already said our constituents they know that we'll deal with the Medicaid issue in conference. He's already said already told us that that's a Trojan horse to get them to go to conference where they can add these other things that are actually going to be incredibly more impactful.
Yeah. So here's what we wanted to convey to people. First of all, the fight is not over by any means, and the fact that they are having such a hard time with this process is absolutely all about the opposition, and the advocacy, the organizing, the phone calls that are being made constantly. So please keep up that work. Don't let up. Do not let up. We have to keep that up. And even if you've called the list of senators already, you called them yesterday, call them again today. They need to be pushed. And Senators Collins and Murkowski need big thank yous. Their votes have been, really courageous. They're being attacked. Although there were other Republicans who voted against it, but they were men. Murkowski and Collins are being attacked. They're
being threatened, like physically threatened too. It's actually incredibly disrespectful and terrifying that other representatives are treating them this way.
So if you do call them, and please do, thank them for their previous votes and ask them to hold strong. And then just pay attention, to the process. We know that it's confusing, but remember that after everything is said and done, all the ups and downs that you will hear about amendments introduced or, whatever, that really the only one that matters is the very last one at the end of the vote-a-rama, and that will be submitted by Mitch McConnell, and you can expect for that to be some version of the skinny repeal. And we need to work like hell, like our lives depend on it, because they do, to get that defeated. And then if it's not defeated, then it goes into conference, and then we still have a little bit more process left. But I know it's exhausting, but this is not the time to give up. This is super important. So that's the main thing. We just wanted you to know it's the last amendment that matters the most, and also your efforts are making a difference, and please don't let up. And we've sent out emails and posted action alerts on Facebook that let you know who to call, but also let you know that you can join a phone canvassing effort where you're actually reaching out to other constituents in some of the states that have Republican senators and getting those constituents to help make calls. And because we need as many people as possible engaged in this process to try to defeat this. And then lastly, remember that this process is nothing about policy. This is not how policy is made. Nothing that has been proposed by the Republicans, whether they're BICRA or the Obamacare repeal or the amendments they're proposing would actually address the problems that people have with the Affordable Care Act in terms of the higher deductibles or rising premiums. So this is very political nature, very unusual, not about health policy at all, and we need to just shut it down if we can.
Thanks.
Thank you.